why does it actually matter, you might say? And we talk about this a lot with clinicians. We talk about it with our customers. We talk about it with payers. Why does this matter? So we've tried to illustrate this big why on using this graphic. So if you look at the red flags on this mountain, what we're really showing is how far up the mountain can a person get in response to rehabilitation. And all of these figures on the mountain demonstrate, based on net level, what kinds of activities you get to pick up if you get further up the mountain. That's kind of the idea. The further up you go, the more activity capacity you have, as well as the more physiological protection the individual has from adverse events, including things like falls, mobility decline, hospital admission, and even mortality. So let's look at the details here. Jennifer Stevens-Lapsley is a researcher, and she's quite interested in what's going on in skilled nursing. And she published some work that really reported what was usual care in skilled nursing. And so these red flags represent, on average, where patients in her study were at admission in skilled nursing. And we are using walking speed as the outcome measure of interest here in our graphic. And then the second red flag represents where those individuals were at discharge from skilled nursing. And again, this is usual care. And what you can see is that when you look over at the levels, that the things that are achieved, is that we're reaching, in usual care in skilled nursing, we're reaching a level of independence with activity limitations essentially needed to go home. But in this study, we were falling short of a level of walking speed, or they also use a short physical performance battery, and a level associated with reduced fall risk. The average discharge values on those measures were actually lower than would be ideal. So we're in usual care in this study, we were still discharging patients. They'd reached some improvements in physical independence with activity, but they hadn't gained enough physiological capacity and reserve to actually be protective for them for fall risk and hospitalization. Now, moving up the mountain graphic, the first green flag represents some of our own internal data in pilot work, where we had our occupational therapists consistently provide a suite of interventions on that patient self-management pillar that I showed you earlier. And what we saw was significantly more gain. So that green flag is planted on where the average discharge walking speed was for those individuals. So we saw significantly more gain than usual care from skilled nursing, providing a suite of interventions designed to improve patient activation and engagement. And that next green flag represents where we got with pilot work with doing the high intensity stepping intervention with our own patients in skilled nursing. And so what you see is that when we systematically apply these interventions for which there's significant evidence, we get significantly more outcome from patients than what's been documented in the literature from usual care.